Namaskar, my name is Dr. Namita Singh. I am a consultant psychologist at Apollo Hospitals in India. Today I would be talking about alcohol use and alcohol abuse. It is often commonly seen that a lot of people use alcohol for entertainment value. They do not really realize that when it goes from entertainment to a habitual dependence or ultimately an addiction, it is important for us to understand those variables and the actual physical, clinical and neural impact of alcohol use. What is alcoholism? Alcohol is a substance use abuse mental disorder in which an individual is drinking alcohol, ethanol to a level where he or she has a dependency, and a regular intake over a period of time results into physical health, organs, systems failing, getting affected. It impairs the social living condition of the individual. It may cost a job, it may cost a relationship, and eventually the person is not able to functional in the current status of life without alcohol at all. What are the causes of alcohol abuse? What is the symptomatology? And what are the treatment options to recover from alcohol abuse? As any disease condition, alcoholism has multiple levels of causative factors. It can be family circumstances, adverse family upbringing, a role model of any adult abusing or overusing alcohol. It can be depression, as I said, underlying medical condition. It can be a part of a genetic predisposition. It can be a way of not having other positive behaviors around to cope up from the environment. It can be a dysfunctional maladjustment in a relationship. It can be dissatisfaction in a work scenario. So, a lot of individuals have a cumulative impact of getting into habit of alcohol use. Symptomatology: if, for example, an individual is often looking for reasons to drink, many times lot of people say weekend is the time I look forward because I can go pub hopping or I can go bar hopping frequently. Is it same as any other addiction? Alcohol is a socially accepted drug which is often regulated but overused and abused. In it, over a period of time, people develop fast dependency and fast reactivity. As I mentioned, socially accepted, and there is no regulation around it in most of the places, especially in India. So what we have been seeing that more younger and younger age group people are getting into these behaviors of alcohol use or abuse. As a clinician, I have experiences with children young as 13 years knowing what different types of drinks are by taste and the quantity. So it kind of worries me because at 13 years the brain neural structure is still becoming stronger or rather growing as such. So because it's a chemical, it's a psychoactive agent, the sooner we start putting those kind of chemicals in the brain, the damage is going to be long term and most likely permanent. So it is important that we discriminate. There is a lot of again research and understanding around it, that alcohol related behaviors use are more of impulse control, disinhibition or disorder. It results into lot of behavior where people get into a behavior of binge drinking over a period of time. How accurate is the movie clip depictions about alcohol use? Many times it is over dramatized, unrealistic portrayal, and it is based out of more of a suspense or a comic value, which is very untrue. In real life scenarios, when we see alcohol related youngsters succumbing to a traumatic brain injury, it's a very big loss to the family. When we see actual movie depiction, it is a wrong portrayal. Many times, many of the important companies promoting alcohol use surrogate marketing strategies. So a lot of youngsters do fall into that macho behavior or feeling in control by using of the substance. It is important to understand really, alcohol per se is not bad, but that demarcation, that what is my threshold or why do I need to do it, why and how much quantity should I regulate, if that is cumulatively taken to consideration, it can be a use occasionally on some celebration, but again age appropriate, under ability to control it, and not ceding or not exceeding because somebody else is wanting you to drink. The takeaway message is, people, this is a very precious life and you cannot throw it away to a substance which ultimately controls you and destroys the life forever. So live well, choose well, and in case you want to make a choice of alcohol, be informed that it has a potential destructive aspect to its use. If you do not control it, it will control you and destroy you. Take care, stay safe, life is beautiful, learn to enjoy it without alcohol too. Namaskar and wish you all well in the life.